Hi, I'm Alex, the nursing assistant. I'm really worried about this new patient, Maria. She's 80 years old and just arrived in the department complaining of chest pain, but she looks pretty breathless to me. I haven't had a chance to find out any more information, but I think she needs to be seen right away. Can you come and see her, please?
Hi there, Maria. I'm your healthcare provider for today. Pleased to meet you.
Thank you for coming to see me so quickly. I feel awful.
Before I ask you anything more, can you confirm your name, age, and date of birth?
Sure, it's Maria Perez. I was born October 13th, and I'm 80 years old. Although today I feel about 100.
Do you have any questions for me?
Not right now, thanks.
How are you feeling now, Maria?
Really unwell. I just don't know what's wrong with me. I can't catch my breath.
Can you tell me about what's brought you in today?
It's my chest. I can't seem to catch my breath, and I've got a bit of a pain too on the right-hand side.
Can you tell me when this all started?
It all started yesterday. I noticed a pain in the right-hand side of my chest. Since then, I've been getting more and more short of breath. I thought I'd better come and get checked out. I've never had anything like this before.
And have you noticed any other symptoms at all? Any fever, cough, or swelling in your legs?
No, just the pain and the shortness of breath.
So you've mentioned that you have some chest pain. Can you tell me more about it?
Yes, that's right. It's on the right side of my chest. It's there all the time and feels sort of dull, but then it feels sharp when I take a deep breath in. I think that's why I'm feeling like I can't catch my breath.
And does the pain travel anywhere else at all?
No, it's staying where it is, I think. Just on the right side.
And aside from the issues you've mentioned, do you have any other medical problems?
So, I have high blood pressure, heart problems, and I had breast cancer. I also have arthritis.
Okay, and what heart problems exactly do you have? And are you having treatment for your breast cancer?
I've had a heart attack before a few years ago, and recently I've been told I have heart failure, but my doctor said it's stable. In terms of the cancer, I couldn't have an operation due to my other medical problems, so I'm on a hormone tablet.
Blood pressure has been taken, but you can recheck the patient's blood pressure at any time using the monitor. You can record your vitals on the early warning system chart on the computer at any time.
Can you tell me what medications you're taking, please?
Oh, there are tons. It may be easier to tell you what I don't take. Let's see. There's Ramipril, bisoprolol, acetaminophen, aspirin, a statin, a water tablet. I also have a spray for under my tongue if I get chest pain. And I take a hormone tablet for the breast cancer. I think it's called letrozole. That's all I can remember.
And are you taking any non-prescription medications?
No.
Are you allergic to anything?
Oh, yes, a few. Penicillin, it gives me an upset stomach. And codeine makes me feel sick.
Can you tell me about your living situation?
I live on my own, but I manage to look after myself just fine. My husband died 11 years ago this time of year.
I'm sorry to hear your husband is gone.
It's okay. It's been a long time. Gosh, it sounds so busy here today. I hope I'm not wasting your time. You must have lots of other patients to see. Excuse me. Can you tell me what you think is going on with me? I'm a little confused as to what's going on.
Let me update you on what's going on at the moment.
Thanks for that update.
Is there anyone around that you feel is a good source of support for you?
Oh, yes, my daughter is a great support to me. I lost my husband years ago.
I'm sorry to hear your husband is gone.
It's okay. It's been a long time. Would I be able to get something for this pain, please? It's getting a bit worse. I haven't had any painkillers yet today.
I'll make sure that's taken to the blood gas machine immediately. The EKG is done. I left it on the desk. The ABG results are back. They're on the desk.
Respiratory rate is on the high end of normal. At the moment, it's 20 breaths per minute. Right, that's all of the vital signs documented on the computer. Capillary refill time is 3 seconds. Normal character, regular pulse, noted tachycardia. Legs appear normal, no pedal edema. Calves are soft and non-tender, and there's no obvious erythema. Let me update you on what's going on at the moment.
Thanks for that update.
Let me update you on where we are clinically at the moment.
Okay, thanks for updating me on the situation and progress.
With the borderline saturation and complaints of chest pain, I'd start some oxygen on this patient. You could also ask her some further questions about what's brought her in, and check the computer for her records. Make sure you have enough information to give to the medical team prior to requesting a review.
Thanks for the handover. Sounds like Maria is really unwell. The acute onset of shortness of breath and chest pain, paired with a history of breast cancer, puts her at risk for blood clots. I've had a look at the computer and see her positive D-dimer, which further points to possible pulmonary embolism. I'll come see her as soon as possible. In the meantime, I think we should begin treatment for the PE and give her something for the pain. I'll put prescriptions on the computer. Get those started and I'll be down to see her shortly.
Okay, that medication's given. Okay, that medication's given. How are you feeling now, Maria?
I'm much more comfortable now, thank you.
Let me update you on where we are clinically at the moment.
Okay, thanks for updating me on the situation and progress.
If you're satisfied that this patient is stable and improving, and you have already liaised with the medical team to make sure all the management plan has been actioned, then you can move on to your next patient. Great job. Sounds like you've addressed all that you can for right now. If you're happy the patient is safe and stable, you can move on to your next patient.